So we've got a couple of big teams, in Leeds and London, but I'm aware that there's smaller teams. So hopefully, shout out, ask some questions. If we can share some, project work or guidance that we have, worked on over the last year, be more than happy to obviously support those out there on their own.
Mm-hmm. I think, like both of us have said before, that where play is about connectivity, play is about the coming together. Even when kids are playing with themselves, they're still connecting with themselves and their environment, and very much to have a playful culture within the team, to have a playful culture, to be able to support children, create the conditions for play to happen. As practitioners, we need to be supported as well, don't we? So I think I absolutely second that. And if there's any like networking or support across different hospitals we can do, that would be absolutely brilliant. Talking about culture though, directly, the work that happens with individual children as they're coming in for their procedures, that's around reducing and minimizing anxiety. I've always noticed that there's something about the way the play team works that actually has an accumulating effect, so that wherever there is play staff, the mood is different. There's an affect that goes along with play that sort of softens quite tricky environments. So if you think about a situation where you're supporting a child in in any area of their procedure, the first thing you want to do is bring them into your calm rather than join them in whatever anxiety might be happening. And so I've always been really interested in how the work of the play specialist and the play worker, actually affects other colleagues as well.
Yeah, absolutely, Laura. Because I think, for us that are working on wards, the play leader, play specialist is part of that team. And like you say, brings the fun element, and the little bit of creativity to that team, which is valued, more than ever in these, difficult times when you're working in a clinical practice. So, yeah, absolutely.
What have things been like for you and your team in the last year?
Challenging, shall we say. Obviously COVID's had its challenges outside the hospital, but inside the hospital they've been really difficult, if I'm honest. We've got a good strong team here, and we have supported each other as much as possible, but there's been big stretches on our time, in the terms of obviously what we can provide for patients and families. And we have worked non-stop, flat out, the reduced visiting, siblings not being able to visit, and grandparents and things like that, that would usually ease some of that burden of, being in hospital all the time for our parents, has not been available. So, not only have we had to obviously support the children, each and every day, it's often that one parent that's there, as well. And, here in Leeds, we have a range of specialities. So we're not talking usually about someone that comes in for 2 or 3 days. This can be weeks, months, so it's been difficult time. And, I'm super proud of the team because they've been bedside throughout all this. Playrooms have been closed. Playrooms have been closed, but we've been bedside with those children on our knees, delivering distraction preparation, therapeutic play, sensory play, whatever's been needed. And, that's been hard because, we've been worried about our families picking up COVID. I got COVID, some members of my team got COVID, and that's a worry.
Yeah, it's a big responsibility, isn't it? Particularly, I think, from my point of view, similar to you there, when members of the team did become ill, that's a huge weight. And I think now we're seeing, as people are coming back and, struggling with the after effects of that, that is enormous. I wondered, should I show some of those photos?
Yeah, please do.
Because you've mentioned sensory play and some of the things that have got us through this year. So we've got some, it's always good to have a visual, isn't it?
Yeah.
So thinking about, some of the materials that we find around the hospital that we would use, absolutely is about normalizing that stuff, isn't it, for children? So we're desensitizing them from this weird environment. And I don't know about anyone else, but to think about play sessions over Zoom, I just couldn't get my head around it. So I absolutely said no, and then had to rethink that. And we have managed to get external partners and to actually get some like genuine play sessions happening over Zoom. What about in your team?
Yeah, we have taken on some virtual sessions, regarding play. But I think the biggest challenge for our team is been delivering the preparation for procedures. So obviously, pre-COVID, we would have the children in, we would see them at appointments and things like that, to obviously really do that role play, that social story, that level of, preparation that was needed for that individual. Because obviously a lot of appointments were done over Attend Anywhere, we felt at times it was difficult, to express and really get that one-to-one meaningfulness that was needed in that session. So, maybe a tool that I would be welcome to share with everybody is that we did record some sessions around preparation for certain procedures, whether it be a blood test, transplant, etc., etc. And we've got those. I'll type it in the chat in a minute, on Leeds Children's Hospital TV. So we couldn't deliver some preparation sessions, which was very frustrating for us. But we've had to adapt and sort of build up our prep resources. And that's been positive because, we might do one session with a child, but actually if it is recorded, you can deliver a couple of minutes to start with, then you can grow it a little bit further, and it's there to obviously be used afterward. So something that I was really negative about was like, oh, a bit like you, how's this going to work? Preparation needs to be delivered, face to face. But actually, we have got a few recordings now on there which have received wonderful feedback from our patients. And one of the things that we're taking to the next level is getting the children to do stories about their procedures and record that and upload it. So, obviously it's good that the play specialists share stories, but children listen to children more. So that's something that we're really, developing and utilizing.
I love that idea. This picture here is an example that was done a few years back by a child who is waiting for a transplant. And if you're on the list for a kidney transplant, you really have to understand how everything works. You've got to understand about your nutrition, waste management within your body, and that sort of creative process that children can go through themselves. Not only sort of is educational, but it minimizes the worry and the fear, because you're making something yourself. And after all, play is is that creative spark, isn't it?
Absolutely. Yeah.
We wanted to talk about like we saw the syringes in the first picture, but this is an example of how on the ward, what potentially they can be quite sterile environments, but this is an example of really just going for syringe painting. So actually you can see that the sheets are completely covering the walls, and we weren't as careful as we possibly could be, because it's an explosive activity. And so I can vouch for the fact that there is still some paint on that ceiling to this day. And you mentioned parents as well. It's been incredibly stressful. I think that play, is a way to sort of soften the mood, but it's not just for children. Would you agree? I mean,
absolutely. Yeah. Especially in some of our, critical, we have got a couple of staff on, that I know are experts in this. So feel free to chip in. But, if we take our pediatric intensive care units and our high dependency units where often children are sedated for long periods of time, you know, encouraging them on some tactile activities, on some sensory activities, you know, is hugely, you know, important, and gives them a sense of purpose in a very difficult, you know, environment. You know, I don't know if anyone wants to, you know, comment on that or share a good experience of something they've done recently with a parent. I know there's some staff on from PICU. Megan, are you on the call? Do you want to comment and maybe share some of the practice that I know that you've done?
Yeah, it's been, so I'm on PICU at Leeds Children's, and this year has been really difficult, and the parents, obviously, you can imagine a child's been admitted to PICU, it can be a critical time for that child's life, and only one parent next to the bedside, which is awful.
Yes.
So we've had to do like sibling packs, and we also, you'll probably see on Facebook, little like the older generation has been knitting us some hearts. So we leave one with the child, and then the parents get a heart each. So then when they're missing each other, they can hold it and squeeze it, and then they know that that child's got that heart at the bedside if they can't come and visit for that time, or there's a surgical procedure going on in the bay or anything like that. We've had to do a lot of sibling packs, obviously, because siblings are not allowed to come in, even the long-termers who might have not seen their siblings for a long time. We do like canvases, so they've done a canvas together, but obviously it's one's at home and one's in hospital. So we've had to, especially on critical care, we've had to think outside of the box. But the knitted hearts have gone so far, and every patient gets one, and the comments and the positivity we get out of the hearts it's such a little thing, but psychologically it's something nice for the parents.
Yeah, and touching,
staying connected, isn't it?
Yeah, and touching on the hearts and staying connected, just while we're on that, you know, a little top tip for everybody, really, for any parent and child that are maybe suffering with going back to school or, you know, being apart from each other because they're in hospital. One of the little things that we do with the children and parents is we get a Sharpie pen and we draw a little heart here on their hand, and each one has a heart. And then if you think, you know, oh, I'm really missing my mum and she's not here, you just press on that heart really hard, and it's like you're giving your mum a big hug. And obviously the parents, you know, do that at home as well. So, you know, that's just a little thing that sometimes, you know, it's the small things that can make a difference, really.
And it's the meaning that you're attaching to that, because
absolutely,
it's and what that speaks to me is that we as human beings, we're constantly making stories. You know, our whole lives are about stories. So like often with you guys, Megan, thank you so much for sharing that. Like actually what you're doing is you're shifting that perception. So like there is the chaos, there is the sort of loneliness and the sadness, and what you're able to do is get in there and just change that story a little bit.
Yeah, absolutely. Romy, I can see you've got your hand up. Did you want to say something? Please join us.
Hi, Romy.
Hi. I was on PICU for about 6 weeks, I think, just covering for a colleague who was recovering from COVID. And the other thing that I found during this time that we've had to be, and obviously always are, advocates for both the children and the parents. And because COVID, I mean, PICU is different. They did allow, on occasions, both parents, but a lot of the time, both parents couldn't come just because of logistics, another parent being at home, looking after other children. And I would advocate for, largely, because as you say, lots of the patients are sedated, for the parent or the carer. Telephone calls were not allowed. And so therefore those children who were maybe waking up, or the families that were missing that child, or their mum who wasn't seeing the other part of the family, weren't able to speak from the ward. And one of the things I managed to do on occasions, it was up to who was in charge. I would go and speak to the nurse in charge and ask for permission for that carer or parent to have contact from the bedside so that that child could see their family members, because that distance was even greater due to COVID. So I think in terms of our role, obviously it's not obvious, the hearts, but and what a beautiful, beautiful thing. But the greatness of our role in terms of just bending rules or hoping to bend rules so that things can happen within such a constrained environment. Bye.
Absolutely.
It's lovely to see you, Romy.
Thank you.
I love that, because to me that's a point that is I think is really important in terms of thinking about what is the possibility, what are the possibilities, and the play team are all about possibilities. And actually it's like how, not whether or not it can be done, but how can we get it done? How can we make that happen?
Yeah.
So creative.
Yeah, absolutely. And I think one of the things, we did a few weeks ago was we had a child and it was going to be their last birthday, obviously palliative, but, they had a birthday party with balloons and bangers and, the whole works. And, it was the play team, that made that happen really, because, it wasn't on anyone else's agenda. The family, that will be a memory that, will be with them for, a long time, and very special memories that, no matter what's happening in the world, are hugely important.
Yeah. It's, I think when people often think about play staff, that's not something that comes to mind. But often it's our team that will do hand molds, do memory boxes, and make sure that it's the experiences and the sense making for the family that's actually happening.
Absolutely. And I'm just reading some of the comments here, and I can see that we've got someone from patient experience, which is great, because we really do feed back in. I don't know about you, Laura, but that feedback that we get from friends and family is always saying the play team had that sort of first interaction with the family that really made a difference to that scary experience. So just being there and able to support from the beginning was really important.
Yeah, no, massively. I often think with our teams that actually we ask such a lot of them. We're asking them to think, in terms of that trust. You're not, as a member of the play team, whether you're a play specialist or play worker, that you're never going there to measure or test or give an injection. It's always about sort of meeting that child where they are, with complete unconditional positive regard, right? They're perfect as far as you're concerned. They don't have to change. They're just brilliant the way they are. And immediately children respond to that. They're just like, they recognize. It's so interesting to see that even though all of the people in our teams are different, they've got this commonality that children can recognize that you're somebody who just absolutely thinks they're brilliant. Oh, I forgot my point, but it was something around relationships. That's right. We're asking the staff to to kind of go in on this emotional level. And back to my point about connectivity, like play is about connection, and actually you're having to bring something of yourself to that environment, but always be sort of self-aware and sensitive enough to not make it about you. So
yeah, absolutely.
It's such a tricky ask.
Yeah. I'm just conscious of time, and I just wanted to, obviously, as Laura did, have we got any questions or anything? I know there was a few messages on my phone from students and things like that. We've got a wealth of knowledge, on the call today. So is there anything specific that anyone wants to ask about the role or the service or functionality? Please stick your hand up. Emma wanted this to be informal, biting on your sandwich, chipping in. So please, drop us a question. If you don't want to speak up, write it in the chat.
Somebody was asking about support for children and recovery, right back at the beginning. And I think it was around, parenting expert and play advocate. Really interested to hear ideas for how parents can get children playing imaginatively and actively to help them bounce back after the restrictions of lockdown.
Yeah.
What do you think, Lisa?
Well, I think that's a good one, because I often get told, and my team often get told, this parent's not playing with the child. they've not had them out the cot and they've not done this. So, you know, and our first question back to them is always, does this parent know how to play? You know, because as we all know, if they've not had the experience of that, then, you know, they're not going to know. And they're sometimes lucky you to say, oh, she's got an answer for everything. But, you know, it's true, you know, once we say this is a mat and, you know, the cat's here and these are some toys and, you know, can we get you out on the floor and, you know, have you seen these sensory things? And, you know, with the support of the play leader and the play specialist, it can move from 5 minutes to 10 minutes to 15 minutes, you know, and we can progress that, you know, they're really enjoying the play. They really feel valued and it's a part of their, you know, treatment, and they can see them making development steps after weeks and weeks. So I think, you know, I've gone off on a little bit of a tangent there, but I just think it's really important that, you know, we expect that everybody knows how to play. We expect, and I'll use me as an example, we expect everybody's good with computers. I'm certainly not, you know. So I think it's about identifying that, you know, if you can see that a parent maybe doesn't have the confidence, you know, being their advocate too and say, hold on a minute here, you know, let's give this patient, you know, a chance. Let's give them an opportunity to, you know, at least try it before you judge and tell me that they're not playing with their child. So again, it's about being that, you know, parent sort of, you know, spokesperson as well.
Yeah. Anne says in response to that permission to play, I think that's so right, that actually do people know that it's okay?
Yeah.
You know, is there a relaxed enough field for play to happen?
Yeah, absolutely. I mean, you know, when I was doing more clinical things and we didn't have the wonderful resource of an iPad, you know, I've been doing this job a long time. So let's go back 30 years. And, you know, and I was tasked with, you know, distracting lots of children with very limited resource and certainly no budget. You know, the greatest thing that I had that I could use in my tool bag was my voice, because I'm an absolutely crap singer. So, you know, but I could sing, or I could, you know, tell nursery rhymes and things like that, silly. And that would have the child, you know, captured for those few minutes. It would have them laughing. It would have them engaged and things like that. My God, did I look stupid? But, you know, it got what I wanted at the end. But, you know, not everybody would have felt happy to do that.
That's so brilliant, Lisa. The thing of making yourself vulnerable enough to look stupid, like that for me is just absolutely key.
Yeah, absolutely. I've just done a presentation this morning and I said, you know, one of the key things is, oh my God, I've not shared my screen before. I've not done this before. And you could tell all these senior leaders were thinking, how dare she admit that? But it's true.
Yeah. Somebody said adults, like, I might struggle with feeling silly. And so I think as a society, this is my call to arms. We've got to normalize getting stuff wrong, normalize looking silly, because it's okay.
Absolutely.
There's a question here about, it's quite a couple of questions that I can see. One is about, can you tell us a little bit more about your play sessions over Zoom? And I would absolutely love to, because I was like Lisa, I was not convinced in any form that they were going to work. So there's a couple of things that really, hi, Amelia is in the background, that were really key for us. So like the fundamentals of play don't change. Unless you think about these things, it's going to be a performance. And a performance is fine if you want it to be like that, but the fundamentals I'm talking about are around dialogue, right? So the environment had to be right. And so, for example, we have an amazing play worker who actually was having to shield. So she was at home and she created this kind of blank environment around her. Romy, who's on the call, actually was the chief bringer of the Zoom into the room. And you know, they're looking forward to connecting with this person who you really want to play with. And then we experimented with some things like matching objects. So, for example, if I had a crinkly bag in my room with some balls inside, we would try to match that so that they're the same things in both environments. And then, to be honest, the the sky was the limit. Like actually the kids just ran with it, and they were doing things like hide and seek in the room with the iPad, just tons of stuff. It was so fun, and it made me realize that there's just like endless potential. I can see that my colleague Evelyn is on the call. I wondered if you wanted to say a couple of words about things that you've learned in your online world delivering sessions for children in hospital.
Hi. Sure. I think it's like what you said about the kids ran with it is like really is really true, because we sort of forget that they grow up in this world. They know so much more about the digital sphere than we do, just by being alive and young. And so while we are pretty scared, or like at the beginning of lockdown, everybody was pretty freaked out by this idea that we could get kids doing like digital sessions, because it was like, no more screens, or safeguarding, that's a nightmare, and it just can't be done. Actually it could be done, and kids really responded to it very well, because they were more familiar with this than we were. So I've definitely found it a lot easier than like leading sessions than I thought I would, because they are already very comfortable in that environment. Mm-hmm. It's not that odd for them. It's not as odd for them as it is for us, and I think that's something to sort of keep in mind. But yeah, I don't really know what else I can comment on, really, Laura.
That sounds brilliant. I think that's good. Yeah. Thanks, Evelyn.
Thank you, Evelyn. I'd just like to say, I don't know about you, Laura, but we have very little budget here. Mm-hmm. So anything that we do tends to be charity based or free. So if there's any of our charity partners on here, I've noticed Kevin from Fairy Bricks. Hello, Kevin. Do you want to say hello? I'm not sure if everybody knows who you are and the wonderful work that you do. Not that I want to put you
on the spot.
Hello.
Here's Kevin. Does everybody know about Fairy Bricks? Kevin, because we love Fairy Bricks.
Oh, we love Fairy Bricks.
And one of the things here has been about individual activities, and absolutely love the donations and the individual sets that we've got from Kevin. Do you want to give us a little update, Kevin, on the wonderful work you do?
Well, I think everybody should know who we are by now, because I don't think there's any hospital in the UK that we don't get to. There's some hospices that we don't get to, so we're in the middle of doing those hospice donations right now. We've only been to, I think, one in Leicester, Rainbows, and Forget Me Not in Huddersfield. So we're trying to prep that at the moment.
There's some people on the call, Kevin, who are not from hospitals at all, so I don't think they'll have any idea what you do.
Okay. Well, basically, Fairy Bricks, we give like children in hospital, and that's it. That's all we do. A lot of people expect us to say something else out of that, but no, that's it. We're here to support you guys as play specialists, and it doesn't just happen in the UK.
No.
Yeah,
the impact of that is just amazing. To get these sets that are like the specialist sets, and it's like Lisa, you mentioned about birthdays. Just to know that actually you can pick a specific Lego set for a specific child that is really gonna light their fire. And to know that you've got that is just like, we're so grateful to you.
Always grateful, Kevin. Thank you very much. Romy, I can see you've got your hand up. Did you want to come in there?
Sorry, it was back to the Zoom sessions and Laura saying I was the giver of Zoom sessions. I have to say they were so brilliant. So at that time I was with lots of long-term patients, and I was a lot of these patients, because they were just sort of stuck in their rooms, were frustrated. And so I was used to playing with them from a health play specialist point of view. And when I would deliver the Zoom sessions that weren't my sessions, I just had to take in the iPad with these brilliant, adept play workers, and either be there to just provide the iPad. I had to learn in a way to pull back, because I wasn't needed, and that was brilliant, and a huge learning curve for me, where you sort of felt like you had to contain everything and look after everything because you're in the room, and I had to learn to manage my work within a space that wasn't where I was meant to be, but I had to be there for, I don't know, reasons. The parent wasn't there, or as I say, providing the iPad. So it was, these online Zoom play sessions were brilliant.
Great.
Yeah, thanks, Romy.
And what about now, Laura, for your online sessions? Have you seen a bit of a drop off on those, or a little bit of less engagement?
No is the answer, because well, it's not as simple as that, because there was a time at which we really wanted to make the most use of our staff who couldn't be physically in the building. So that was part of the drive. However, unintended consequences that we found was that actually there are loads of children who weren't accessing great stuff that was going on because they couldn't leave their rooms, or they couldn't mix with other children, and they were too vulnerable. And now this has opened a whole new door to them. And so the work that Evelyn is doing now is about bringing partners in, like the amazing Catherine, who you saw in the picture that I showed, and coordinate it. I mean, as well as National Portrait Gallery and the Welcome Collection and others. So those remote sessions are a way for children to get together, actually, when they're isolated, and it's just been amazing.
I know for our young people, we had quite an active, virtual program to start with, which was so well received by young people. But actually, we've seen a drop off, of young people wanting to participate in that. Quite interestingly, the number one activity on there was baking, which nice. I think is, quite interesting, and still remains the number one activity that young people want to do virtually. We have a youth worker that is doing a baking activity. They're given a list of their ingredients, and obviously, it follows the activity sort of program. But that has been the biggest hit, really, with young people.
It's something we've not done yet, but I can see that that's going to be on the list for our next holiday program.
Yeah.
It sounds terrifying, but I'd be interested. Yeah. Like children pouring stuff on themselves. I have.
Does anyone else have some, a top tip that they would like to share with anybody that, has been really sort of, embedded within their practice the last year during COVID? Don't be
shy.
Don't be shy. I'll give you another one while everybody's thinking. So I'm sure everybody knows about the magic string. So that's a tool that, that's a tool that we've had for a long time. So some rainbow string, or you can personalize the string. And if we're doing a procedure where obviously the parent can't be in the room, such as radiotherapy or something like that, the child can hold the string. You can run the string to the end of the door, under the door. Mum then can grab the string and you can tug the string, and it's just a way of the parent and the child staying connected through, which can be quite a challenging procedure. So you can use that for a range of, things. For example, if you were trying to get your child to sit on the toilet on their own for the first time, and things like that. So we call it the magic string, and it's great. It's cheap. You can personalize it. Emma would love it because you could add a bit of glitter to it. I'm sure yours would be all glittery and sparkly, and things like that. So that's just, another one that, I would share and get anyone to add to the tool bag. The magic string, because sometimes being without your parent is daunting for some of these procedures.
Yeah, and that's acts as a transitional object, doesn't it? The thing that makes the story be like you're closer together than you actually are.
Yeah.
I was just going to say Nick's got his hand up.
Perfect.
Hi, I'm Nick. I don't work in a hospital at all. I'm a hobbyist 3D printer, and if children are struggling and you want to teach them, you can do things like you can create models of toys. So this is like a model of a dialysis machine.
Oh my God.
And I put little magnets in his art in this so it can like connect to the teddy. This was for a little girl who's dealing with dialysis at home. Her dad has it, and she saved his life 3 times by ringing the ambulance, and his mum got in touch and said, can I make this for her? So
we all want one, Nick.
Yeah, we definitely do.
This is a homemade toy. I don't quite I've only got 2 3D printers, and I've got a full-time job as well. But I've been making other stuff, like I've made a boots and bar.
Yes. For
Um,
orthopedics, perfect.
That's a shunt valve. So the shunt valve is actually lab tested and CE marked, and I've shipped 300 of these to children across the globe.
Wow.
There's a UK charity that I've made 120 of these for, and they're putting them in doctors' packs so that surgeons can explain them to children using teddies.
Never mind the surgeons, the play staff need them.
And then a cochlear implant. I made a teddy foot splint. Made a teddy boots and bar. And then a play therapist asked me to make something for ADHD. So this is like an acrylic brain with a cloudy limbic system to try and explain it.
Amazing.
So this is just, and that's a teddy bear insulin pump.
Wow.
Nick, that's amazing.
So,
oh my God.
Yeah,
I can make all these things. And I've got a full-time job working in automation, but you guys need to know what I can make. I don't know how to take this forwards.
There's a whole group of people here who want to be on your contact list, or who want your contact so that they can get in touch with you for help and advice, and basically to place orders with you, Nick. Would you be happy to share your contact details?
Yes, I'll give you my email.
You will be inundated. Jacqueline's absolutely right.
3D printers are really, really slow, and I don't know how to make this into a business from a hobby, but I would like to see it grow from 2 3D printers to like a whole stack of 3D printers and kick all this stuff out at volume.
I'm so curious, Nick, what made you first get into this?
So 12 months ago, right at the start of COVID, I started making PPE. I made about 12,500 items and shipped it to all the local hospitals free of charge. I shut that down when the shortage was over, and then started 3D Toy Shop making normal toys. And then a parent got in touch with me and said, can I design a toy for someone with hydrocephalus? So I designed the teddy shunt valve, shared that online, and 68,000 people went to my Facebook page. So then I paid a lab to certify it as safe according to the EU legislation, and I've developed that into like a standalone product. And I've just been taking more requests to develop bespoke toys for individual children. And I've now got a collection of 3D models, like a teddy bear white stick, and I'm just making toys to help kids. And I figured that you guys all needed to know what I was doing.
Wonderful, wonderful. Nick, thank you so much for sharing. That's amazing. We'll be in touch.
So, Lisa, I'm actually quite close to Leeds. I live in Morley.
Hey, we're first on the list.
If you'd like to arrange a meeting, and I can come and bring all this stuff down and I can show you what's possible.
Amazing.
Cool.
Yes, please, Nick.
Put your contact details in the chat, haven't you?
Yeah, my email address is in the chat. If you send me an email, I'll come over to the LGI and I'll show you what I've made.
Thank you, Nick. Appreciate that. Thank
Louise,
you.
What did you want to say? Louise Danter.
Hi. Oh, should we put the phone? Hi, I'm Laura. From the Gloucester Royal play team, the play specialists, and we were. I was very upset when the playroom got closed. It seemed like it was a big blow to us, and taking all the toys in to take them away from all the children. So what we felt was we needed another way of showing the children what toys we had. So we made like Deliveroo, we did Playaroo. So,
awesome.
So we did a toy menu. I'll see if we can get the video. Hang on. I can't seem to get the thingy on. Hang on. But we did a play menu. So it's a laminated sheet with about 30 different play toys and activities on. And that's in each of the rooms. So there's a toy menu. And then we gave an introduction to ourselves. So we go in the morning, but it gives them the toy hotline so that we can deliver freshly cleaned toys to them when they phone the toy hotline. And it gives them an idea of what toys we've got on offer.
Love it.
It's brilliant.
It's a visual sort of cue for children. Some children that don't have English as their first language, and also for children with additional needs. And the other thing is that with the toy hotline, they phone directly to our phone, which we have directly to the play team. And I found it's good for teenagers as well, especially if they've got mental health admissions, because it gives them a direct way of contacting us, and that we can then go and see them as well. It just gives them an additional way of expressing themselves and giving them that option and choices, basically. So it's gone down quite well. So it's just another thing that we did that we'll probably keep going on with after COVID.
So creative.
Brilliant.
So brilliant. I love that whole thing about, you know, actually something visual. Sometimes if you're, you know, in any way sort of tired or, you know, just not feeling like you've only got so much energy, that's just brilliant to be able to see it. And what is it called? Toyaroo.
So it's Playaroo.
Playaroo.
Playaroo, like Deliveroo. But it was, yeah, we had a few questions about what to call it, but it does introduce the play team and the play service, and it helps the parents as well, because at least they know what's on offer. Trouble is, we need an awful lot more Nintendo Switches.
Yeah.
Because they all seem to choose that, which is a bit of a pain. But yeah, and it just gives them ideas of what they can do as well.
Absolutely brilliant.
Great. Thank you for sharing, Louise. That's absolutely wonderful. We'll all be doing that now, and I can see people going mad in the chat.
Everybody's furiously writing that down. They'll be in hospitals across the country.
Anything else that people want to share? This is wonderful practice to be sharing. You know, and I think, you know, if we can all go away with lots of ideas, you know, that's wonderful.
One other thing, I wrote an app for Android that convinces children to wash their hands. You scan the hands, it takes a picture, and then it animates germs over the hands. They go wash their hands, and then the germs disappear, and then they get a prize.
Wow.
3-year-old at the start of lockdown, and it's free, and it's on Android, and I've just put the link in the chat.
Thank you.
That's brilliant.
Great, thank you.
So sorry if it's a little bit buggy, but it does kind of work.
It must have been really fun to make, Nick, was it?
Yes, because she recorded all the sounds. Every time you hear the germ buster say something like "wash your hands" or "germs were found," that's my 3-year-old recorded.
Oh,
it was
lovely.
It was good.
Family business.
Yeah.
Oh, thank you.
Anyone else? Anyone else, or any questions that you want to ask Laura or myself? Emma's waving.
Emma's got her hand up.
It's
I think
just an idea
technically
that
you need to put your hand up.
Well, you know, I couldn't actually find the hand button, so I was talking to a pal who does things on a global scale, and she was like, what about, we're doing a lot of chalking as part of Love to Play, and she was like, what if you know, the children in hospital can't obviously leave their beds or come out of the hospital? How could people do chalking or on their behalf? So it's not a fully formed idea yet, but it could be. There could be a whole load of buddies outside of hospitals who'd be happy to be issued commands. I think it might be chalking. Thinking back to your Zoom kind of stuff of like, we've also been doing something this week where we've got a roving reporter who I command, like challenge Annika, for those of you who remember such days. And she's up for anything, quite frankly. And I was like, it's quite fun to be remote controlled by people. Well, she's told me that she likes it anyway. So, you know, I don't know if that already happens, but perhaps, you know, people could be the servant of children somehow.
I love it.
Well, we often,
yeah,
we often find, Emma, you know, when we give the children the control of things, then we have a better compliance and participation, shall we say, in treatments. And an example for those not working in hospitals, if a doctor says, right, we're going to do the blood test on a child at 10 o'clock, and, you know, we sometimes say, are we going to let them do your bloods at 10 o'clock, or are we going to let them do your bloods at 10:30? And sometimes if it's a procedure that's maybe not going too well, we'll intervene and just say, can we have a little break? And, you know, what time would be good for you to start doing this again, Jimmy? And, you know, blah, blah, blah. And we sort of pass the control over to the child. They don't really have the control because, you know, no matter what, this procedure is going to have to take part. But it does help with, you know, obviously, you know, taking part of the procedure because they feel they've got some control, you know, in the decision making, in that abnormal environment that, you know, can be not more any abnormal anywhere, I'm sure.
Yeah, but the hospital is full of experts and it's full of machines and it's full of, like, it's not, I mean, our hospitals, our children's areas are, but, you know, generally children come in with quite a low power status.
Yeah.
And actually in those interactions, you're giving them enough power to feel like, oh, okay, I can make a change here. I can subvert what's happening.
Yeah. We've got a question from Ryan Laura. So his question is, who on here has referrals from consultants to help children with needle phobias?
All the time.
Yeah, so we have a play service referral inbox where we get referrals from, consultants, doctors, nurses, and we would look at that referral. And, our input into phlebotomy, we would try to make at the beginning of a child's experience. So we're starting off onto a positive. Obviously, that's not always possible, or it's, bloods happen in the middle of the night when there's not play staff around and things like that. So we do take a lot of referrals. And, the play team would look at doing some, desensitization work, some good preparation, some good distraction to support that child. Absolutely. And I think it's banging away at your consultants that actually, let's try these early interventions. Let's try these tools that the play specialist can deliver and support on before we think about a referral to psychology. So I see it as that early intervention. So that's what we do at Leeds. We do take lots of referrals from consultants. We have a very good relationship with, and the specialities with those play specialists as well as general. Laura, I don't know if it's the same for you.
Yeah, absolutely. So we work with a referral system, so all the patient records are digitalized, and play specialists have their own way of being referred to in a patient's pathway. Just picking up on that needle phobia, what we often try to do is dig down into what is meant by needle phobia. So the sort of a fear that is like justified, that somebody's going to put a needle in you. Often that's what we can work with, whereas a phobia, I would pass that across to my psychology colleagues. But the key here when you're supporting children is putting them right at the centre and making sure that you're all communicating and working together to get the best outcomes. But yeah, no, other than that, I absolutely agree with you. That sort of early intervention, desensitization, and again, taking control. So the preparation work sometimes could be before you walk in through the door. We might send out some of the materials that you might see when your blood test is happening. So that you can get used to handling those things and they become a little bit less scary. So
great.
That is that. Oh, somebody's got their hand up there, Lisa. Are you?
Yeah, Michelle.
Over?
Hi everyone. I just a couple of things that I sort of was following on, especially what you just said about phobia, not a phobia, when it's an appropriate fear. And what I find is that sort of pre-admission nurses will say, oh yeah, they're phobic, but actually they're not. They're just appropriately scared. And they don't always need a referral to psychologists. They just need someone skilled in play to distract and to prepare and to support them through it. And I've been trying to work on changing the terminology in our pre-admission paperwork. So phobic, absolutely refer to psychologist. Sort of ordinarily scared but can be distracted, needs a play specialist, or no, I'm okay with it, then that's fine. That was one thing I wanted to say. And sort of
flagging.
Yeah, but also as well, just whilst I've got you all, one of the things I'm sort of fighting with is I just would like to know how many of you guys are permitted to put Emla or Nulbia cream on, because that's the thing that I'm going through, and our pharmacists have sort of said no at the moment, but because we are governed by a registering body, we're trying to sort of say that as band 5s, we can put it on because we've got the time to put it on in a nice sort of soothing way and giving the children control, because I've got more time to do it. Right, do you want to put your cream on? Going back to control again, especially I work in a paediatric and adolescent unit, so my whole remit is about giving the adolescents control back. But just wondered if
it's a good topic. It's a good point, Michelle. And yeah, absolutely. I can see the advantages and know the advantages of a play specialist doing that, like you say, as part of the prep work. But then in my other half of my role with my manager head on, it's a prescribed drug. And, should a play specialist be given a prescribed drug? So we've had these questions before in Leeds, and currently play staff are not allowed to put on the EMLA because of the reasons I've just said. It's a prescribed drug. But what we do use is sometimes we'll use toothpaste as a substitute, you know, for the EMLA and things like that, you know, within the role play. And sometimes when obviously it is needed to put in, we have to bring in that, you know, professional nurse to put on the EMLA. So I'm not saying it's right or wrong, and it'd be interesting to hear Laura's, but I think there's absolute, you know, positive outcomes from the play specialist put it on. But with my manager read on, it's a prescribed drug. If that child has an allergic reaction and drops down dead on the spot, shall we say, it's a tricky one. There's pros and cons, I think, to both. Laura?
Yeah, I'm with you there. I'm with you there, Lisa. I'm with you 100%.
You know, this feels like I cannot actually believe I looked at the clock and it's nearly 5:30.
Wow.
Already.
Unbelievable.
No. And I don't know if do you generally as a sort of group of people do much of this sort of networking and sharing, because it's brilliant listening in on it, and I just wonder, have you had the chance to connect like this across the country over lockdown, where you do share what's working and what have you?
Not so much.
Not so much.
Yeah.
I think in-house, you know, we've done our best in-house, and I'm sure Laura's the same.
Yeah.
But I think nationally, and I think, you know, my big shout out goes to those smaller teams, maybe where there's one or two play leaders and play specialists.
Yeah.
And you know, it'd be great if everyone wanted to continue with something like that. Jill, I can see you've got your hand up.
Or were you just celebrating the idea? Celebrating those little teams. I wonder if, Emma, we could, you know, offer out to anybody on this group who is interested in some further events where, you know, on the sort of playing hospital topic, connection, sharing ideas.
We'd love to be part of hosting it if it's helpful to all. So I think what today feels like we've just scratched the surface, haven't we, of many very interesting conversations. And as you know, some of the comments already are sort of saying you don't get enough chances to network. So perhaps somebody might want to come up with the next subject matter, or we could maybe review, did we get through all of the things that we wanted to talk about today? I know there were so many meaty bits on the Eventbrite, weren't they, of like culture change and sustainability and friendship and fun. So yeah, use the comments to let us know if you want some more.
Do we have time to just see what Carol would like to say?
Yeah, and also nobody needs to leave unless, you know, Lisa and Laura and whoever, leave as you see fit. And if Laura and Lisa have to dash to get on with other things, then obviously we'll pull it to a close, but we can carry on. There's no problem with continuing as long as you two are able to stay a little bit longer.
Yeah, no, more than happy to answer any questions or anything like that. I think, you know, more than ever, as we all know, it's about helping each other and being kind to each other. And if we can do that, you know, I'm sure Laura's the same, if we've helped somebody that might be, you know, feeling a bit long working and a bit burnt out with COVID, and we can help you, then, you know, please let's all try and help each other.
Yeah, absolutely. Absolutely ditto to that, Lisa. Carol, did you tell us? Yeah.
Hello. I just wanted to say how very useful this is, and we would, as a very small team, we would really benefit from networking, and even when we're allowed to some visiting, so that we can do some benchmarking with everybody. But thank you for this, and we're going to stay as long as you're here.
Awesome.
That's great, Carol. And just so that you know, when I first started, I was a team of one. So, you know, I get that lone working, and you know what it's like sometimes on your own when you're one of, you know, not very many. So I was one, and we're 32 now. So, you know, I know that feeling, you know, walking on the ward and thinking, here, everybody looking at me say, she's here again, that happy person. What the bloody hell's she going to do today?
And it's not even just that, it's you become absolutely master of everything.
Absolutely.
You become a TV repair person, or someone that's going to run the drugs up. You know, all of these things.
I sometimes get calls to the office because somebody wants biscuits, and I'm like, hang on a minute, can I just ask why you're calling us for biscuits? Well, it turns out that the play worker did a biscuit decorating activity last week, and the consultants saw that. And then this week they've got a difficult child, so they'd quite like some biscuits if that would be okay. So I'm calling the office. I'm like, no, I think you need to try the cafe. Amazing.
It'd be good as well, you know, obviously I don't want to put people on the spot, you know, students, you know, I know it's been difficult for you guys, not being, you know, maybe getting as much practical experience as you want, and, you know, things like that. So, you know, individually or, you know, on these sessions, always happy to try and, you know, build up obviously student confidence and help students where we can as well.
Yeah, I mean, I think we've got such a responsibility, Lisa, haven't we, to support students who are undertaking the course. You know, 2 years is a long time, and often, you know, with bigger teams like ours, we do have the capacity to take students in, to offer them mentorship, but more widely, like it's in everybody's interest to make sure that we're communicating and supporting and having those conversations. And I really think it goes back to what we were saying earlier about basically a culture of safety. Like, it's actually okay to say, do you know what, I think I might have missed that lesson, I might have missed that conversation, like I don't know what anyone's talking about, or this has come up and I'm a bit lost. Just to have people in a broader community to be able to speak to.
Absolutely. And, you know, just to say as well, I don't know about you, Laura, but oh my God, I've been stressed through this when you're managing a team and they're all looking to you to make those decisions. And, you know, you want to make sure they're the right decisions, but sometimes you're like, is this the right thing to do? Oh my God. But, you know, sometimes we bluff it and wing it, you know, and I'm like, oh, that's wonderful. It's going to be great. It's going to be absolutely fine. No,
I so agree with you. And the thing is to be decisive and be like, that's what we're doing. And know in the back of your mind that if you can see that's not going right, you're going to call everybody back in the room and say, okay, we're going to rethink this and do it again, and know that that's okay.
Well, I'm just looking at some of the comments in there, and I'm not going to name people, but, you know, again, big shout out to students. If anybody's finding it difficult, drop me or Laura an email. You know, I work closely with Leeds City's College, where the, you know, play specialist course is run. You know, we'll do what we can, you know, to help you. Nobody needs to go away from here thinking that they've got no one to call for help, because we are here, and I'm sure we're all on the same page.
Yes.
Yvonne.
Yeah. Oh, hi. Yeah, I just wanted to say hello. I'm currently at Pinderfields as a student. It's my first year, and we've been having to do so many different things to, you know, work outside the box. We're only in a very small unit, and on a burns unit, and we've had to do so many different you know, I come up with different ideas on how to work through supporting the children. And I've just had to get my creative head on, because fortunately I like creating and I like play, and just thinking outside the box all the time, and just using different materials that you can make up yourself, which is what I've been doing constantly, just putting packs together, so that the children can get involved with their parents, so that they can also play, because otherwise we haven't been able to do anything. I mean, no one can see anybody either, can they? You know, as a student, I found that quite weird. We're all in masks and goggles are on, and so on and so forth. And you just got to try and, you know, be reassuring as well when you're when you're with them, to know that you're still there to, you know, help them.
Yeah, absolutely. And I suppose, you know, just for other people as well, a big shout out to those play leaders and play specialists that had to even step up for COVID, and were, you know, redeployed as healthcares and retrained as healthcares to help in, you know, our adult departments. You know, hopefully they should be coming back, you know, to us soon now. Numbers and pressures are easing, but, you know, to people that had to step up to do that, total respect, and, you know, big shout out.
Yeah, such a massive challenge. Bless you. I wanted to ask Kate, would you be able to just give us a little outline of the project, that the Play Observatory, because like we've spoken a lot about play during COVID, and obviously the Play Observatory is about collecting and sharing those stories.
Yeah, sure. Hi, everybody, and thank you for such a brilliant session. I don't work in hospitals, and I'm in awe of those of you that do and that have over the last year. I'm based at UCL Institute of Education, and we're working with several partners, including staff at the University of Sheffield and Laura and others, to research children's play experiences during the COVID-19 pandemic. So we are creating an archive of play, trying to sort of collect examples, what's been going on screen, off screen, indoors, outdoors. How have children played with people that they haven't been able to see in person? How have games themselves changed and adapted? How have children referred to the pandemic in their imagery, their role play, and things like that. So we've got a survey running at the moment that is designed for children to respond to themselves and also for adults to input their observations and examples. That's at play-observatory.com. And we're going to be working over the coming months. It's running up until the start of next year with Laura and others. And in particular with Laura, we're thinking about developing play wellbeing toolkits where we can really get the message about the power of play in times of stress and uncertainty out to the adults that work with children. But yeah, I'll put the link in the chat. And if any of you have any examples of things that children have been doing or know children that would like to take part, it would be really fantastic if you could spread the word.
Great. And just one thing to follow on from that, Kate, I'm not sure if everybody will be aware of the Play Impact Report by Starlight. So that's obviously 2020, the latest piece of documentation. I can send it to Emma, who can maybe pin it in the chat. I can't do both because I'm not good with computers, but maybe a member of my team can pin that impact report in there and we can share it, because that's got some latest, we're not very good at research and getting a lot of research at Play Hospital, are we, Laura? But this is the latest report.
Yeah, that's right. Yeah, I just was going to say on that it is a priority for us in the next couple of years. So I have recently brought together Lee Hudson, who's our head of mental health, Faith Gibson, who is the lead researcher for patient experience, and Paul Ramchandani, the Lego professor at Cambridge, just to start, and also Alison, to start to think about what does a research project look like that actually does that, because there is a massive gap. You're absolutely right. And my head just explodes at, the idea that actually we can address that, because it needs to be addressed. It's no good us saying, no, but it really works. No, but it really, really works. We know, the kids know, we actually have to have some evidence, and it's up to us. It's our responsibility to get the right people in the room and make it happen. So
yeah, just an interesting fact following on from that around research is we've got some funding now for 6 months to research and put some dedicated health play specialist time into VR, virtual reality. So we've got some funding for a charity, and that's something we're going to commission for 6 months. They've obviously given us the insight and impact team and data and all these very clever people that are going to obviously collate all that wonderful data. So, that's a big thing for us in Leeds, as I say. So we're excited about that, and hopefully we'll share it soon.
It's such a big world, isn't it? Virtual reality, augmented reality, all of that stuff. And, isolation, if you are in hospital, virtual reality is something that actually makes your experience that much bigger. Immersive experience. So I'm so excited to hear about that.
On this note, because I'm conscious that you probably need to have a stretch for your legs and all the rest of it before getting on with the rest of the afternoon, perhaps some of the sort of things like immersive technologies and digital, I think there's many strands that might come out of today's conversation, and perhaps we can have a little unpacking and then really send out an email to all participants that have joined us today. If you have put your details in the chat, do let me know if you don't want them sharing, okay? But otherwise, we're not going to do any posh editing of this video. It's going to be pretty much as it is. And so again, if you've got any concerns or you've said anything that you think, ooh, I don't actually want that going out and the rest of the world seeing it, please do get in contact with me, and I'll make sure. But before anybody gets to see the video, we'll send you a private link so that you get a heads up on it first. I'm not a professional editor, so please don't come back with 100 editing suggestions. My one plea as well is that you get a piece of chalk. It shouldn't be hard for you lot. Piece of chalk, and somewhere #LoveToPlay2021. We're not going to stop at the end of this week. It's really, we join hands with everybody else who's doing playful things throughout the year, and the website should allow for people to upload their own events. So whilst we kickstarted it this week, we really want it to be a useful resource all year round for anybody who wants to communicate. They've got something playful that they want to engage other people in. So we're lovetoplay.fun. And I think what I love about everybody who's involved in play is just how generous they are and open. And this has been one of the delights for me of this week, because you two have done a brilliant job of facilitation, and your kindness as well. It just shines through in terms of how you're so thoughtful about everybody. You know, we talked earlier in the sort of festival about a parliament of play. And I really think if people who are involved in play had more power, actually, sort of at all levels of their organisations and society, wouldn't the world be a better place?
Oh, absolutely. Brilliant, Emma. Yeah,
let's
I
make
agree.
it so. Let's make it so.
Make it so.
Lovely ending, Emma. I couldn't have put it back myself. Well done.
Thank you so much for joining us, and I'm sure this is the start of something brilliant. It's wonderful to see networking. So enjoy the rest of your week. Do chalk, do share the love. We've got robot jousting actually, 5 o'clock tonight. So if you want to get online and have fun with a guy, actually, Ross Atkin, he's brilliant. Follow him. He was his thing's called the Crafty Robot, but his real job is inclusive design. So he works with like the City of London, for example, to really do user-centered design around accessible streets. But he, on the side, because he's a bit of a genius, also makes telepresence robots, which would be perfect for hospitals, actually, because you can remote control them from different places, and they are at a sort of skirting board level. So it's like a little, your iPhone is the head of the robot, and someone else is remote controlling it around, and vice versa. So do join in for that. Tune in, and thanks for joining us.
Thank you very much, everyone.
Thank you so much. Lovely to see you, Anne. Thanks, Emma.
Thank you, Emma. Bye.
That was lovely.
That was really good. I'm just going to stop recording now.